My name is Catherine. I'm going to be your nurse today. I'm washing my hands and I'm putting gloves on. Can I please have your name and date of birth?
My name is Ellie Quintana. My date of birth is April 12th, 1954.
And what's your MRN?
5, 4, 3, 2, 1.
Okay, perfect. Very nice to meet you, Ellie. So I see here in the chart that you don't have any allergies. Is that correct?
Yes.
Okay, are you allergic to anything?
I am not allergic to anything.
No food or medication?
No food, no medication.
Okay, perfect. Okay. All right, Ellie. Can you tell me what your name is?
Ellie,
Okay, can you tell me where you are?
I am in Tampa, Florida.
Okay. Are you at work? Are you in the hospital? Are you at home?
I'm at home.
Okay. And what year is it?
2021,
What month is it?
April.
Okay, and can you tell me who the president is?
Joseph Biden.
Okay, perfect. All right, so the patient is alert and oriented ×4, does not seem to be in any distress, and is sitting comfortably. Both sides of the body seem symmetrical, and there doesn't seem to be any weakness on either. So look at your hair and your scalp. Hair looks clean and neat. Scalp doesn't seem to have any lesions or cuts or abrasions. And I'm going to look at your nails. Your nails look pink. Capillary refill seems to be less than 3 seconds on each side. No skin tenting. Skin looks clean, dry, warm, both sides of the body. And if I take the socks off, the capillary refill is less than 3 and there's no skin tenting either. And again, bilateral lower extremities seem warm and dry and appropriate for ethnicity on both sides. And your head and your eyes and your nose and your throat, just to make sure that everything looks normal. So your ears don't seem to have any lesions or skin breakdown on either side. They look clean and dry. Your eyes look healthy. There's no reddening of the conjunctiva or swelling, and the sclera looks white. No drooping. Can you follow my finger for me for a moment? Okay, so eyes are perla. If I look at them with my pen light, they accommodate to light on both sides. All right, and the nose, there's no drainage. Can you smile for me? With your teeth, show me your teeth and smile. Okay, smile looks symmetric on both sides. There's no facial drooping. And can you open your mouth for me? Mucous membranes look pink, moist, intact. And can you say ah so I can look in your throat really quickly? Say ah. Okay, ah again, sorry. Alright, yep, and the throat does not look reddened, no spots on the tonsils, intact, pink, and respiratory assessment on you. So first, I'm going to listen to all of the bases of your lungs. I'm going to start at the top and listen to all the fields, and then I'm going to listen to the bases at the bottom. I'm going to listen to the front and the back of your lungs, and then I'm going to feel to see if you're breathing equally on both sides. Breathe in. Lung sounds are clear and equally bilaterally through the apex and the bases in both upper quadrants, in the lower quadrants, and the middle. And expansion is equal and symmetric on both sides. Okay, so now I'm going to do a cardiac assessment on you. So first I'm going to start by palpating your carotid artery. I'm going to palpate on each side, one at a time. All right. And it's equal, +2 on both sides. Next I'm going to feel your radial pulses. All right, equal, 2 on both sides. I'm going to feel your dorsalis pedis pulses. Equal, +2 on both sides. All right, next I would palpate the PMI and note any bruits that I encounter. And now I'm going to auscultate your carotid, so I'm going to listen on both sides with my stethoscope. All right, no bruits noted. So next I'm going to listen to your heart sounds. So I'm going to start with listening to all of your heart sounds with the diaphragm of my stethoscope, and then I'll turn it on and listen with the bell of my stethoscope, okay? So starting with the aortic, and that's going to be on the right sternal border, second intercostal space. Next, I'm going to listen to the pulmonic. That's the left sternal border, second intercostal space as well. Now, Erb's point, which is also the left sternal border at the third intercostal space. All right, the tricuspid valve, which is the left sternal border at the fourth intercostal space. And finally, the mitral valve, which is the mid-sternal line at the fifth intercostal space. Now I'm going to turn my stethoscope over and listen with the bell. So once again, starting with the aortic at the right sternal border, second intercostal space. Then the pulmonic, which is the left sternal border, second intercostal space. Erb's point, which is the left sternal border, third intercostal space. Tricuspid valve, which is left sternal border, fourth intercostal space. And the mitral valve, which is the mid-sternal line, or mid-clavicular line, the fifth intercostal space. Heart sounds are all normal, equal, no murmurs noted. So first I would look at the stomach. I have the patient lying supine, so it looks equal and rounded on both sides. Next, I would auscultate in all four quadrants, starting with the right upper quadrant, auscultating with the diaphragm of the stethoscope. Next, I would listen with my bell over the aorta and note any bruits. No bruise are present. Bowel sounds are equal and normal active in all quadrants. Next, I would palpate. Feel for any masses in the stomach. Have you been having any GI symptoms, any nausea, vomiting, diarrhea, or constipation? Right for you, so if you need anything, you just press on it and I can come help you. So here you go. Do you know how to use it?
Yes, I do.
Okay, can you explain to me how to use it?
If I need anything, I'll just press the button
Mm-hmm.
and I'll be waiting for you.
Okay, all right, definitely. So the bed is in its lowest position. The wheels are locked, both side rails are up, and the patient's call light is within reach. Is there anything that I can get for you?
No, thank you so much.
You're sure you don't need anything?
No.
Okay. All right. Patient looks comfortable, not in distress. Safety checks are done. I'm taking my gloves off and I'm washing my hands. All right. Feel better. If there's anything you need, feel free to press the call light.
Thank you so much.
You're welcome.